All right, now that I've hit the recording button, I think we could get started. Welcome everyone again. Thanks for joining. Again, my name is Mary Mackey. I'm the project manager on the Moving Forward Coalition team. Today's webinar, it's one of our many webinars where we dive into one of the 9 action plans that we launched in late July. And today's a little special. We'll be learning from 2 of the action plans focused on workforce. One action plan on CNA or certified nursing assistant wages, specifically around how some states have MIPS or Medicaid incentive payment programs that could be incentivized. And another action plan on expanding career pathways for certified nursing assistants or CNAs by developing and piloting a standardized CNA career pathway model. If you could give me a moment, I'm going to pull up the slides for today's call. And I can share what you can expect from today's call. So I will be starting us off, grounding us a little bit in who we are, what the coalition is, if you aren't familiar already, a little bit about what an action plan is, and then we'll be passing it off to Michelle Dion-Pahalik and Betsy White, who will be sharing about their action plans. And then, of course, we'll have some time for questions after their presentation. So please chat in your questions throughout the call. And then, of course, we'll be wrapping up with ways you can stay connected with the action plans and the coalition. And before we get into it, we want to thank the John A. Hartford Foundation for funding the Moving Forward Coalition. Thank you for making this work happen. And the Moving Forward Coalition. So who are we? We are a diverse group of individuals and organizations who have come together committed to drive specific, actionable improvement in nursing home quality. We have about 1,300 individuals, including residents, CNAs, advocates, nursing home providers, QIN, QIOs, you name it, from across the country. And these individuals, I think many of whom are on this call, make this work sustainable so we can continue this important work. And the coalition's purpose is to develop, test, and promote action plans to improve nursing home resident quality of care and life. And we're now doing this by taking the action plans we published in July and beginning to implement them step by step. And if you aren't familiar already, each of these action plans describes a specific challenge facing nursing homes today, explains why we prioritize them, why it's important, and outlines a step-by-step path to how the coalition plans to achieve them. The coalition's vision and mission were developed with many of who are in the coalition today. Our vision is that every nursing home will be a community in which lives are nurtured, residents are empowered, and where people want to work. And our mission really is a means to that vision, where we want to make vital changes in policy and practice through power of bringing diverse voices together now. So our action plans, what is an action plan? Our action plans came to be when the coalition started to take a look at the recommendations in the April 2022 NASEM report. As many of you know, it's a rather lengthy report, and we wanted to take that rather lengthy report and translate them into actionable steps now. So we took that report and identified which of the recommendations in that report could be prioritized as topics that could be acted on and piloted on and implemented now. And in the end, we prioritized a couple of focuses, which we translated into these 9 action plans. And today we'll be hearing from 2 of those action plans, specifically on workforce and certified nursing assistants. So with that, and actually before I pass it off to Michelle and Betsy, Alice, would you like to add anything else?
I have nothing else to add. Hi, everybody. We're really glad you're here, and we really hope for a robust conversation. We know this is the topic that's on everybody's minds. We hear it every day, and we know you do as well. So thanks, and back to you, Samari.
Great, thanks, Alice. And I'll pass it off to you, Michelle.
good morning, or good afternoon, depending upon what part of the country you're in. I am Michelle Dion-Vahalik. I'm grateful to be part of the coalition, the Moving Forward coalition, and here today to share some of the information related to an action plan that has to do with improving certified nurse aide wages and support through a Medicaid incentive payment program. Certified nurse aides, more than better than I do, are the crux of the workforce within a long-term care community. And pre-COVID, we knew that homes were struggling with recruitment and retention of the certified nurse aide. And a lot of it had to do with potentially low wages. I think COVID highlighted the importance of the certified nurse aide within a long-term care facility and how crucial they were to the success of resident care and outcome. With that being said, the National Association of Healthcare Assistants did a survey sometime back evaluating certified nurse aides and the workforce related to recruitment and retention. One of the things they found out was the number one was wages, where low wages were partly responsible for the turnover as well as recruiting new staff. So one of the things we took a look at was trying to explore what is already out there known as a quality incentive payment program that is under the Centers for Medicare and Medicaid Services. And could a program like this potentially be used to supplement wages that could actually raise the hourly rate for this workforce? So you're going to actually see where the action plan on the slide in the center, we illustrate what the focus is and the rationale for why. If we could move to the next slide, that would be great. So 3 main goals. One is to conduct research with the existing 51 states of those who might have a quality incentive payment program to see if a state had put forward a metric that was similar to workforce enhancement or maybe encompassed increased wages, as well as conversations with the Centers for Medicare and Medicaid Services about their quality incentive payment program, specifically restrictions, can we not do. Some of the things that we learned is there are a couple states that we were able to explore deeper, which is part of Goal 2, which we've moved to, and how they built their incentive payment programs and those metrics and what those metrics are demonstrating right now as outcome. In other words, have the states been able to make progress in these areas? Some of the things that are critical to know about an incentive payment program is that they do have to be attached to an actual metric that demonstrates improvement toward the overall care of a resident or someone who lives in a long-term care facility. In addition to, there has to be what the state establishes as a baseline. In other words, what do we see across the state in this area, and what is the actual benchmark we want the provider to get to? So all of that has to be studied and looked at as well. From there, what we want to do is collaborate with CMS, be able to possibly produce some additional guidance to states on how to go about developing a payment program that does have a workforce measure that strictly does focus on wages. In other words, raising the wage for a certified nurse aide specifically, as well as, is there anything we can recommend to CMS policy-wise that they could put out or consider as future guidance to states? Next slide, please. So in looking at a couple states, progress to date, we have specifically looked at Illinois, California. We've actually met with several federal state agencies and other state agencies to gather information and learn about their current quality incentive payment programs, their successes, their pitfalls, as well as we did meet with the Centers for Medicare and Medicaid Services And our overall timeline right now is to be able to develop this comprehensive guide that we can share with states, kind of like a how-to manual and step-by-step maybe on how to go about building a quality incentive payment program based on what we've learned, and maybe even some examples from other states, lessons learned, by the spring of 2024. Overall, we'd like to be able to develop a proposal to the Centers for Medicare and Medicaid Services to include guidance on the inclusion of compensation related and potentially other workforce metrics. So where we're at right now is to begin the search for those 1 to 2 states that either have a quality incentive payment program already developed and maybe looking at evolving their metrics, or a state that is about to develop or launch a quality incentive payment program, or even a state that's eager that says, I'm really interested in this. We'd like to partner and give it a whirl, or give it a shot, I should say. Very optimistic, since a quality incentive payment program can actually provide enhanced funding to a nursing facility. And the good thing about a quality incentive payment program, the facility does have to demonstrate how those quality incentive payments were used within the actual facility to benefit the overall care and quality of life of an actual resident residing in that home. And the way we're viewing it is, if you're able to up wages, recruit and retain your staff, which leads to many other things such as consistent assignment, more person-centered care, and adequate staffing, meaning residents get the care that they're actually entitled and deserve to, the quality of life would automatically rise. So we do see the connection. We do see the ability for a state to be successful in building a quality incentive payment metric that would target increasing wages for the certified nurse aide community. And so with that being said, I believe that's the slides that I have, and of course, happy to answer any questions as we continue throughout our presentation. I'm going to stop to see if Alice or anyone else on the coalition, if I missed anything or you want to add to this, to this initiative.
Thanks so much, Michelle. And the only thing I would add is just to remind folks that a lot of the work that our committee and our work groups have done has really been around the differences between states, as Michelle pointed out. And, some states have, these programs that do include workforce metrics. A lot of them have similar programs, but that do not include the workforce metrics. So what we're finding is there's a lot of opportunities, and there's opportunities to communicate more within a state, because sometimes we found that people within the state that are working in this space don't necessarily know about the incentive program. So all of that's important. I think Dr. Sharma wrote in, have you looked at Iowa? They have QAAF that was meant to increase wages as well, but probably poorly structured. Would you like to say more about that, Hari? We can unmute you if you want to add to anything to that.
Yeah, I'm just wondering about, how much you've explored evidence base and some of these programs. And I was looking at Iowa, haven't done a whole lot of work on it, but, some of these programs have incentives that are meant to increase wages, but the way they are structured, facilities can, pay workers in different ways. And, sometimes, some of these changes in terms of benefits may not be visible, and workers probably care more about, the direct wages rather than some of the other benefits, which are kind of a mixed bag. So just wondering if you've explored anything about Iowa or other states that have these programs, but do not directly tie back to wage increases, but maybe could be more than just wages.
Yeah, Michelle, you can jump in here. I know that there has been some work, and we've got a couple of slides. I'm going to see if I can look them up now, with comparisons across states of which states do actually have a closer pass through, if you will, or system of passing through the wages to the workers, and other states that it's not as strong an association. So you're raising a really good point. Michelle, what else would you say in terms of the group's work?
What I can share is exactly, Alice, what you just covered, in addition to Specifically on Iowa, we have not analyzed Iowa per se. I've made note of it. We're able to pull that and take a look at what they've done and the success rate there. You did raise, though, something that I want to touch on, which is different ways of incentivizing or enhancing what could be perceived as a wage for certified nurse aide. What we're focusing on is crystal clear that the component or the metric would actually raise the dollar to dollar, meaning the actual reimbursement to the actual certified nurse aide based on their hourly rate. So the CNA would walk away with a higher wage versus any other type of incentive that might enhance their overall compensation package, but might not be as visible or as transparent to the aide themselves, meaning they don't see it in the paycheck that they take home. They see it in other ways. So hopefully that answered the question there.
Other questions or comments? I'm going to chat in a link here to one of the reports that Michelle and the team looked at with comparing different Medicaid programs across states, in case that's helpful.
Great. Thank you, Alice. And I do want to make sure we have time for Betsy's presentation. So if anyone has questions, please do chat them in and we'll have some time to talk about them later in the call. Thank you again, Michelle, for walking us through these incentive payment programs and the coalition's plans on understanding how these programs can be leveraged to improve wages for CNAs, recognizing that CNAs are really a vital part of our nursing home workforce. So with that, I want to pass the mic off to Betsy White. Betsy, I believe you're on.
Hi, everyone.
There we go.
Betsy White. Happy to be here. I'm an assistant professor at Brown University in the School of Public Health. I co-chair the CNA Pathway Group, work group, along with Joan Weiss from HRSA. Another one of our work group members, Sue Malini, was going to present today, but had a family emergency, so I'm kind of pinch hitting here. So next slide, please. So our work group has been very busy. This is the group here on the screen, and lots of kind of hard, complex thinking, and it's really been a privilege to work with everyone here. So next slide. And so yeah, I'll be talking about the CNA Career Pathway Plan, which is the second action plan out of the Workforce Committee. It's on the website, and I'll get into the details of it. And there's a link here, but you can find it on the website also. So not to, just to level set again with the background, Michelle talked about this as well. This was a vulnerable workforce to begin with. The pandemic has made things even worse. So, this is over the course of the pandemic. This is from Kaiser. Obviously skilled nursing facilities have not rebounded in terms of employment anywhere near as far as other healthcare sectors. So, next slide. So, same as what Michelle was talking about. Retention is going to be really key for this workforce, particularly now with the new staffing standards coming down the pipeline. Really, really important to invest in and support and develop this workforce. So CNAs, as we all know, are the core of the nursing home workforce. The care that they're providing is increasingly complex, and they face limited opportunities for advancement. They often feel that they're unprepared to provide the care that they need to provide to this increasingly complex population, and they feel underappreciated. Job dissatisfaction, and these are things that contribute to job dissatisfaction and burnout, which is a major factor contributing to turnover, which then feeds into staff shortages, which further exacerbates job dissatisfaction and burnout, and we're just in this perpetual cycle here. So we're really, thinking about how can we build out CNA career pathways to help, intervene in this circle and really support and advance, provide opportunities for this workforce to advance and develop themselves. Next slide. So this is, again, the NACA survey that Michelle referenced. This was in July. So this was just kind of a couple of key questions here. This was a sample of about 1,400 nursing home CNAs. As we all know, better wages and benefits, top priority for that would help CNAs to want to stay in their jobs. Also, scheduling flexibility, staffing, key issues. But we would also highlight here, over 40% of CNAs are saying that they need better training and they need opportunities for career advancement. So this is another key area for intervention. Next slide. Also from the NACA survey, they asked this question: do you want to stay a CNA if you were able to receive additional education, pay raises, and recognition? And overwhelmingly here, I think too often we get into the narrative, thinking of this workforce as a dispendable workforce, oh, well, they can go work in retail or Amazon or whatever. And this really, I think, counters that narrative and says, people who become CNAs, they want to be CNAs, they want to take care of people. And we really need to support and invest in them because of this. Next slide. And then finally, another key question out of the NACA survey were, what are areas of education that you need? And you can see here, dementia and end-of-life care were high on the priority list. Also, infection control was a key one too. And there's been a lot of that during the pandemic. Next slide. So our goal is to work with key stakeholders to develop and pilot a standardized, underlying the word standardized there, CNA career pathway model under the Registered Apprenticeship Program framework. And I'm going to talk a little bit about what registered apprenticeships are. The guiding recommendations out of the NASM report were the same recommendation that Michelle referenced about improving wages for CNAs, and then also the recommendation around advancing the role of and empowering CNAs. Those are our key guiding recommendations. Next slide. So part of our initial work of our work group has been doing a scoping review of existing models, both past and present. And the key takeaway here is that when we're talking about CNA professional development, it's like, here's a pilot, here's a pilot, here's a pilot, here's a small initiative over here, here's a small initiative over here. They tend to be very small in scale. They don't really grow, and they're all very different, which makes it very difficult for portability for a CNA who goes through one pathway model to achieve a credential that they can then pick up and go somewhere else and reap the benefit of that. It also makes it hard to evaluate them, develop the evidence base, to support replicability. So that's kind of the key takeaway here. It's all these little pilot models kind of all over the place. So what we have learned, though, similarities across some of the models that we've learned about. We've probably learned about quite a bit, maybe about a dozen models that actually are for existing CNAs to advance. Key similarities, they tend to do a lot of education around dementia, behavioral health, end-of-life care, restorative nursing, leadership. We see, referencing back to the NACA survey, some of those were key priority areas. They include a wage progression. So as a CNA is moving through the tiers, they achieve higher wages. And among those who participate, they're generally really well perceived. Differences, however, as I mentioned, different number of tiers, different credentials. Some lead to, kind of a certification like a med tech. Others, they're just receiving professional competencies. Some are done within the registered apprenticeship framework. Some are not. Considerable heterogeneity in terms of funding sources. How these things are being funded. And may or may not include a path to, specific certification or licensure. I mentioned MedTech. Also, there are apprenticeships out there that support CNAs to go to LPN or to, nursing home administrator or whatnot. So, huge variation. But key point here is the variation, and they tend to be small and they tend to have issues with scale. Next slide. So, and just to kind of level set, because there's, we've kind of learned about 3 buckets of models here. So first, most of the apprenticeships that are out there, and these are registered apprenticeships, they train to CNA certification. So they're basically for entry to practice. Probably the best model of this out there is SEIU. SEIU has developed what I would call a robust and replicable model across multiple states, where they bring people in, have them go through the CNA certification, provide a lot of wraparound services, and they've been able to replicate that in several states under their training and employment funds. Then there's kind of a separate bucket of initiatives, which are career pathways for existing CNAs without apprenticeship. So one of the models that's been very informative for us is NACA works with the California ACA affiliate and their educational foundation, and they are using the NACA educational models, and they're right now going through a pilot, a 5-county state pilot, where the CNA goes through the the different educational pieces, and again, wage progression as they go, but that is being done outside of the registered apprenticeship model. And then the final pathway, or the final kind of bucket of programs that we've learned about are career pathways for existing CNAs, meaning like the starting point for the pathway is you're already a CNA, you've already achieved certification, and then it's done under the framework of the registered apprenticeship model. So next slide. Okay, so what are registered apprenticeships? Registered apprenticeships are through the U.S. Department of Labor. There's an Office of Apprenticeship. There is a federal Office of Apprenticeship, and then many states have their own apprenticeship agencies. In some states, apprenticeships, the accreditation process happens through the federal Office of Apprenticeship, and in some states it goes through the state apprenticeship agency. Without going too much into the weeds here, the key points here is it's an earn and learn model. So there's a standard didactic component that comes with the apprenticeship. It's mentored learning on the job. So the apprentice is paired with a mentor. They go through this educational pieces, and there's a standard that provides guidance on that apprenticeship. And at the end of the apprenticeship, they receive a nationally recognized portable credential. Our idea with the model is, we can develop a national standard for this apprenticeship model, and then that would be available to be replicated down the road. When we can replicate things, we can evaluate them. We can build the evidence base to make the business case to employers to receive additional funding. Replication is really important and has been guiding us for this. Another key benefit with apprenticeships is that there's a lot of money being put into apprenticeships within the last couple of years, both through the federal governments and then a number of state governments have apprenticeship-specific funding that can be leveraged in order to invest in this workforce. Additionally, the Federal Department of Labor, the U.S. Department of Labor, has contracted with these industry intermediaries. There's 3 different companies that support the administrative and technical aspects of apprenticeship. Those intermediaries also, they get incentive funding that they can distribute. And as I mentioned, there's a lot of federal and state grants. So just a lot of resources out there that can be tapped. And that's really what we're trying to do, is we're trying to understand, what are the resources that are already out there that we can tap in order to really make a change with, things that are feasible. So next slide. So our proposal is to develop a national registered apprenticeship standard for CNA pathway, underlined in bold, designed to be replicable. We right now are partnering with the ACA and Leading Age affiliates. Our goal is to do a 2-state pilot. And right now we are having preliminary discussions with state affiliates for those groups in 2 different states. I'll hold off on mentioning the states just because we're still kind of in the preliminary discussions, but we have a series of discussions planned. The goal is that we would kind of write this national standard. We would pilot it in these 2 states with the engagement of these stakeholders. And we would build the pathway with existing educational resources. So I mentioned the NACA educational modules before. NACA has put a lot of investment into their some of their educational modules. They have a preceptorship, peer preceptorship module that they've educated thousands of CNAs. It's a well-established model. It's out there. It's it's CNAs training other CNAs, and they really understand what the educational pieces are. So we're hoping to be able to leverage these educational pieces that are already out there. Another key partner that we're in the process of talking to right now are the geriatric workforce enhancement programs. These are educational institutions in different states that receive HRSA funding to do education in nursing homes. And so they already receive funding. So it's, again, leveraging existing resources. So we're looking to collaborate with the state affiliates to engage employers and begin to pilot in the 2 states by June of 2024. I would say where we are with our discussions right now, we're probably on good timeline with that. We have also engaged with one of the industry intermediaries that's federally contracted with the Department of Labor. We're working with Equus Workforce Solutions to coordinate some of the regulatory and administrative aspects on this, provide guidance, and help to access funding to support these programs. And then, we're also, leveraging the platform of the Moving Forward Coalition and, the diverse stakeholders that we have represented here to, promote this idea and just really let people know that, we need to, build these pathways, have models, and for CNAs to advance. And then we're also going to be planning for an evaluation. We have a number of academic partners that we work with, and that will, towards the end of the timeline, we'll be starting to put that plan together. Next slide. So this is kind of like the sketched out pathway that we are looking at right now. And this is, again, based on our scoping review of different models that are out there, identifying the key areas of similarity. The nice thing about writing a national standard for an apprenticeship program is you can actually write flexibility into it, because we understand that, particularly when you're talking about CNA education, you quickly get into the weeds of different state regulations, different state certifications. So we are trying to do this where there's both structure, but then also some flexibility built into the model. So this is kind of the proposal. This is not the final model, but this is kind of like what we're working with at the moment. So we're talking about having a CNA who's been employed at least 6 months. That would be the starting point. And this can also be used by employers as a recruitment retention tool. Hey, you come in, we have this program after you're here for 6 months and you've gotten your feet under you. We have this, program to support your growth. So CNA has been employed at least 6 months. The first tier is the certified preceptor course that NACA runs that I mentioned before. This is probably it's a fairly low lift class. It's online education. It's an 8-hour class. Pair it with mentorship, but this is really to help CNAs, develop some of the leadership skills that they need to help to educate and support their peers within their own organization. Then we're talking about having, and I should say this whole thing is proposed to be like a 2-year track with each tier. Back just a second. With each tier being a 6-month track, and with each tier comes a wage progression. So the second and third tiers, here's where we would build in some of the flexibility, where either one of the GWEPs, the Geriatric Workforce Enhancement Programs, or other educators, we have to have dialogues with some of the stakeholders in the states about other educator partners that they work with, having a tier around dementia and behavioral health, end-of-life care, restorative nurse aid, different options that they can kind of pick and choose. But so again, some flexibility built in there. And then the fourth tier is back to another NACA educational course, the Geriatric Care Specialist. Again, this is online learning, and it's really meant to, it actually teaches like anatomy. It teaches like really helping to give CNAs some of like the clinical tools they need to understand and provide high quality care to the increasingly complex nursing home population. So as I said, this is, we kind of walk a balance of being prescriptive enough that people kind of know what we're talking about. And, again, we're trying to move towards a more standardized model while also incorporating some flexibility and, having opportunity here where we can modify this as we're working with our stakeholders in the states. Next slide. So, one question that we've heard is like, how is this different from all those other little pathway models that we've heard all over the place? Why is this going to be any different? One of the key points is that we've learned lots of lessons from hearing about these other models, where the challenges were, where the facilitators were. we're really making an effort to engage stakeholders with national footprints to support replication. As I said, NACA is a key partner in this. The ACA and the leading age affiliates, the geriatric workforce enhancement programs, all of these partners we're trying to work with. So it's not just a one state, one employer type model. We want to try to leverage existing educational resources, as I said, to promote standardization, reduce cognitive burden on employers, because everyone's flat out. We know just adding one more thing to people is burdensome. We're planning for an evaluation. We have the partners as part of the coalition who can help to support that evaluation. And then most importantly is just the timing of this right now. The combination of the pandemic and then new staffing standards coming down the pipeline, retention is going to be so important to invest in and support. The recent investment in apprenticeships, both at the federal and state levels, really important. Those resources are out there and we can leverage them. And then finally, the Moving Forward Coalition. We have a huge, strong network of diverse voices, and this is really the opportunity where we can, promote this idea and use the leverage of the leverage and platform of the coalition to help promote this. And the one last piece that I'll just say, I think this is the last slide. But we, in addition to planning for this 2-state pilot, our work group has also been having a number of conversations with various parties in different states. And even the states that we're not going to be in with pilots, we're still kind of talking to them and helping them to network and understanding, okay, well, if you're thinking about this kind of thing, who do your key partners need to be? What are the resources in your state? So we've had a series of those conversations with a number of states. And yeah, it's been a very busy, productive work group, and happy to take any questions. Was that the last one I had?
Yes, thank you, Betsy. Thank you so much for so thoroughly outlining this pilot program. I saw Mary chatting in before this presentation that higher wages don't always mean happier teams and workplace. And I think, Betsy, your presentation just talked about exactly that, focused on what you heard matters to CNAs and how another component to ensuring CNAs are to empower in their role is to expand their career pathways and to provide educational resources. And I did see, Mary, you had chatted in a couple of comments and wanted to make sure you had a chance to share or add anything more.
I think we need to unmute her. Maybe you did, Mary. Okay.
Yeah, so I've worked in nursing homes for over 35 years, mainly with residents with dementia. I think another thing we need to focus on is the ratios. Because of the shortage right now, we're losing people because they can't give the care that they're taught to do. So you can do all the teaching you want, but if they don't have the resources and don't have the personnel, then they can't do what they're taught to do. So I also teach a high school class to be CNAs, so they'll be certified nursing assistants, which some nursing schools are now requiring. But I'm not going to be able to attract young people from high school into this profession because it's just not attractive to them when they're there in clinicals and people are already overworked and taking shortcuts and doing things like that. It's just not attractive to my students. So somehow we got to attract people to and Betsy, I think, talked about that, but what are we going to do right now is my question, to attract people into this workforce.
So I'll jump in and then Betsy can, I'm sure, add to that. So Mary, you are channeling what we think about and what keeps us all up at night and everything else. We have got to figure out some things to do right now. We're not going to be able to wait. So we agree with you about that. One of the initiatives around the country that is trying to do some of what you described or address some of what you described is the Teaching Nursing Home Initiative in the state of Pennsylvania. I don't know if we have anybody from PA on the phone here, but it's putting deans and faculty from schools of nursing, really well-established university and community colleges together with nursing homes. So they started out very small, just 4 nursing homes and 3 schools of nursing, but they worked for a year to really build the relationships, make it different when students go into nursing homes for clinical placement, find mentors, the things that you talked about, so that it doesn't come across as just such a challenging environment that none of us would want to do it. And we have to find those bright lights and highlight them, and then try to scale and spread from where we have really good nursing homes, which we have a lot of them, but they're not everywhere, and we have to find them and promote them. So it's going to take a lot of work. I think you're right. It's not going to be an overnight thing where we're going to snap our fingers and say, let's just go fix this right now. We need to build the relationships, build the trust. We need to develop the work with the community colleges. There are community colleges, again, in Pennsylvania, where they have something like $75 million that was just approved. So we absolutely need to come together. And I think the work at the state level is what we talk about a lot in the coalition as being super important, because each of the states here is so different. And I know Kim Hadson is also on this call. She works with Betsy and the team, and just trying to find the information in each state about how we can promote these programs for CNA advancement and the other ones that are related is a big, has been a big effort, and we need to continue it. So I'm really glad that you raised those thoughts, and I hope other people will chime in too. I don't know if Rowena Shepard wants to say something, because Rowena is one of our committee members who is a CNA, and she's on a lot of our calls. Rowena, do you have thoughts about life in the nursing home? You're always have something to add. So anything you want to say?
I'm not sure where to start. Right now, that is really, that's the problem now, because it's hard. Even my daughter, and she's 16, and she said absolutely not going to. So it's kind of hard to attract like young people now to get into CNA jobs. And it's also the hair, when they go there and look what they can see, and like you said, Mary, that the CNAs are exhausted when they go there, and like, that's all they say, they seen. And when I started, which is not even that far along, 7 years ago, when I go to nursing home, and I seen mostly the CNAs that mentored me was like happy to be there, and express that I don't know, that feeling that you will see them, that they're happy to be there. I don't see that much anymore. Every time I turn around, and CNAs are like, I don't even know why I care. They don't care about us. So it's kind of hard. So even if the wages will go up and stuff, there's still other things to consider. Yeah, so thank you.
Yeah, I mean, those are excellent points, and that's what we've been hearing loud and clear. I think kind of my take is that a lot of the discussion right now, when we're talking about building the CNA workforce, is about getting people into the pipeline, and we talk about how to certify them and where to find them, and the entry to practice piece. And then there's very little conversation once they're actually in the job. And I think just what you were saying, Rowena, that's the issue. And both from the NACA survey and what we've heard from other CNAs is like they just don't feel prepared. Like it's a hard job coming in and working in a nursing home, and staffing needs to get better, and all these things. And there's lots and lots of evidence that the way that you improve retention is by improving the work environment, and it's wages and benefits are an important piece of that. as is, having a good organizational culture, having safe staffing. And also a key piece of that is having opportunities for advancement. So, we think of this both as a retention and a recruitment tool for an employer to say, like, hey, we want to invest in you. Because, remember also, like, turnover is costly to an employer. I mean, the estimates vary, but anywhere between like $4,000 to $10,000 to replace a CNA. Plus, then you lose just the institutional knowledge, and it's just this constant turn. So if you can improve retention, that also helps with staffing, because if you just have this, if you're bringing CNAs in and you're not doing anything to invest in them, then they just get, they burn out and they leave, and then you're back in that perpetual cycle of just staffing shortages and burnout and all this. So yes, really important point. Thank you for raising them.
And I see that Lauren talked about some of the things that they've done in her community, which is a rural community, but having students go through the training and the programs. Lauren, I don't know if you want to say a few more words about, how has that worked? Because again, we're looking for the bright spots here and how we can take something that worked and scale it to other places.
Hi there, can everybody hear me?
Mm-hmm. Yep.
So we started partnering mid-COVID with our local high schools, and because of the CNA requirement, they were looking at places to get people certified anyway. So a lot of what was said as far as how the high schools don't see nursing homes and long-term care as the shiny hospital and want to be there all the time, we've run into that some, but we found that educating beforehand on trying to find people who have a passion for the elderly, people who have been raised by grandparents, people who've had a strong influence from the elderly in their lives has made a difference. We don't keep every student that we put through our class, but we've definitely had some who stay longer than the average 2 or 3 months that we were getting, which has added to our workforce. And then we offer a scholarship program to sponsor them to be able to go through to get their LPN and RN and retain them as nurses. It's not a perfect model, but it's definitely been nice to have the support of the schools, and they've in turn started their own program where they have like a fast track where we will next year have our first group that are actually graduating from high school as LPNs. Between the partnership with us being able to put them through our CNA class. We've also found that being able to work with their school schedule and having them be part-time and fill in gaps on our weekend schedules because of their school schedules. We are a little unique. We don't have school on Fridays for our local high schools. So that's given them more working days, but just those few things of being able to give them a few working hours here and there, working with their high school schedule and getting them through the class, because of the rural community that we're in, and there is high drug rate, high crime rate where we're at, it's given them kind of a path to be able to go through and just a different way to be successful.
That's great. That's really helpful to hear about that. And the flexible work schedule certainly sounds like it contributes to the effectiveness. Betsy, I know Hari wrote in about asking a little bit more about the career pathways and, the wages, how that helps CNAs in terms of their wages. Anything else we would want to add about that?
Yeah, so one of the things that the industry intermediaries do is they provide state-specific guidance as to what is an appropriate wage progression, over the course of the apprenticeship model, and they provide that guidance to the employers. So I don't know if that gets at the question, but so a part of in building this model is that we want to kind of establish, at a state level, kind of, with this model, what's an appropriate wage progression with the guidance of the intermediary. Again, so it's not like, this employer is doing one thing, this employer is doing another thing, this employer is doing another thing. Like, we're trying to provide a little bit more robust guidance there.
And I think the other point that Betsy makes a lot, and the whole team does, is it is about the employers being part of this. So I think that may also be part of what you're getting at is, the nursing homes that employ CNAs need to acknowledge and buy into this advancement pathway, so that if I'm a CNA and I take advanced training, I pay for that advanced training, I take time away from work, and I have all of a sudden, I've put together these advanced skills, now I'm going to be in a new role in the nursing home. I'm going to be director of CNAs, or I'm going to be director of CNA education, or whatever my title becomes. I need to get recognized with wages that are appropriate and compensate me for those additional advanced skills. So the nursing homes are very much a part of the conversations that Betsy's been talking about and that Michelle talked about. The nursing homes have to be at the table. They have to understand the opportunities here and be able to figure out for themselves what can they bring to the conversation. So Hari, I don't know if that helps more, but could you say a little bit more about what you're related to your question?
Yeah, I was just thinking about, we talk about living wage and, all sorts of jobs. And, I often talk to other, organizations working in the space where, if people have to take two jobs just to meet their basic needs, so how do we go from making this, one job career? So to what extent do the wages have to go up, and would the employers see that value in paying the workers enough so that they don't have to go out and seek, some of the public benefits, because the wage is enough for them to get out of that hole in some ways? So can we prove that value to employers? And are you seeing some evidence of that in some of your work that you're doing, and also continue to do in that space?
Yeah, so part of this is an evaluation plan, and again, the idea of standardization is so that we can evaluate it. And you can, because when you have like a little pilot and you have, 2 employers participating, you don't have an adequate sample size to do anything and make that business case back to the employer. So we're hoping to get, enough volume of nursing homes participating where we can do a good, robust evaluation and then turn that data back and say, hey, look, this is really important, not just to the development of the individual CNA, but also, to the your own operations. So, yeah, good points.
And I was just typing in also to add to what Betsy said, that we have 2 individual nursing home owner operators, administrators on the steering committee. And in addition, we have organizations like Leading Age and AHCA that have many members that are nursing home members, thousands of them. And so, when there's an opportunity, we can reach out to them, and they do participate. They're on most of the committees and the work groups. So we do run things by them all the time, and they need to be at the table. Absolutely. Because they need to they need to sign on to the, the wages and the benefits issues. I see that Mary typed in another comment that, the communities have the CDP program, but now that they don't have enough staff to cover people to take time away from work to go to those programs. And again, I will say we hear those kinds of comments quite a bit now because, staffing levels are much lower than pre-pandemic. So it's a challenge. Again, we have to figure out, okay, what does that mean for online learning? Yeah, Betsy and Michelle both talked about online learning, but that's what a lot of these programs are looking at doing, is moving away from the classroom, moving away from travel, and saying it might not be our favorite way to do this, but we can make this work. We can do a good job. So.
Yeah, and we've definitely been having those conversations about kind of the format of delivering education. What we don't want to do is like have this be yet another in-service that you're pulling somebody off the floor to like go to a class. No. We've heard from the CNAs on our work group, from the NACA representatives. We've been having this discussion about kind of the benefits of in-person versus online learning. The NACA modules specifically were built as online, and they've done a really nice job of kind of carving them into little manageable pieces so that they can be done online. We've also heard, so Deanna Duffy, who's on our work group, her organization, they kind of had a similar program, and they, had a dedicated education day, or they had a dedicated, a certain number of hours every month where they were, it was built into their staffing schedule that, the CNA was going to be off the floor and at this. So that's kind of the model that we're, the employer is actually giving dedicated time to provide the education, not just like pulling a CNA off the floor during their regular shift. So really important points. Yes, it's challenging, but we've been in the weeds of those discussions.
Well, thank you so much, Betsy and Michelle, both for your presentations today. Before I move on to some next steps and ways you can stay engaged, I did want to highlight Michelle's comment in the chat, recognizing that long-term care is a profession and specialty, and we really need to be undoing that stigma to recognize that in CNAs. So thank you again, both Betsy and Michelle. Thank you to everyone else who is from the coalition who joined today's call. For those who haven't had the chance to take a look at these 2 action plans yet, please do. We've chatted them in. They're available on our website. We have 7 other action plans that detail other specific challenges within nursing homes and the coalition's plans to pilot and test them within the next year. If you have any questions about the action plans at all, you can always reach us at info@movingforwardcoalition.org. And if you want to stay in the know about our latest progress on these action plans and want to be in the know of upcoming events like this, do join our newsletter that's available on our website. And our last coalition conversation webinar of this series will be taking place next week. And we'll focus on the action plan on the Health Information Technology Readiness Guide the coalition is piloting. And thank you all for joining today. We'll be sharing the recording and the chat with you all shortly after this call. Alice or Isaac, would you add anything else?
Thank you so much, everyone. And thank you, Betsy and Michelle and Samira for leading the call.
Great, thank you all.